Hello, I'm Harvey Godwin, Chairman of the Lumbee Tribe, and we're out here at the Culture Center next to the Ancestral Wigwam, which is next to the structure for the Elders' Fire. And it is winter solstice, celebration of life's wisdom. Unfortunately, the elders haven't been able to be out here since COVID came upon us and social distance and have the Elders' Fire. But it's been a few months, and I wanted to give you an update along with Dr. Chamaine Brooks-Locklear about where we stand with COVID. Are we doing any better? Are we doing worse as a community and as a people? And I just glad she was able to come on today and just give us an update. Dr. Chamaine, I know it's been a while since we last talked and a lot of things have happened, but I'd like for you to give the people an update where you see that we stand in this current situation.
Thanks for having me back in.
You're welcome.
Well, one thing is for sure, we keep having a lot more cases here in North Carolina locally. So the numbers as of today show that in North Carolina we have a total of over 382,000 cases with over 2,000 admissions currently, over 5,000 deaths in the state. And in Robeson County, as of today, we have 7,708 cases with 123 deaths. So the bad news is we're having way more cases the past few weeks. In fact, the past week we've had over 30,000 cases in North Carolina. The last 2 days we've had over 5,000 cases per day, which is astronomical. We're hitting high records in our state of North Carolina. We're seeing increase in admissions week by week by week. We're seeing more deaths. We know a lot of the deaths from COVID are usually those that are 65 and older and tend to be nursing home patients as well. Those in nursing facilities don't usually do as well with COVID. The good news is that now compared to earlier a few months ago, we do have better treatments for COVID. So we have some good treatment options if you're sick enough to be in the hospital. So if you have a severe complication, we have some treatments that are helping. And so these good treatments are helping to reduce the mortality rate. So the fatality rate now is a little lower than earlier on in the pandemic. And then of course we have some vaccines on the horizon. So there is some good news ahead. But the biggest thing I see is that there's still folks not understanding basic principles to COVID. Basics to getting tested, basics of the virology of COVID versus flu. There's still a lot of misconceptions. And now that we're still right now in the flu season, I wanted to just harp on some differences between COVID and flu or influenza. So there's many differences, but a few highlights that are different between COVID, which is coronavirus disease, and influenza is that coronavirus is definitely more contagious than influenza. Coronavirus tends to last longer than influenza. Coronavirus has a much longer incubation period, meaning from the time that you're exposed to a person with COVID, it can take 14 days or longer before you actually get sick with COVID-19, which is very different from flu. Typically with flu, when you're exposed, 1 or 2 days later, you're sick. So you know to stay at home because you feel bad. With coronavirus, it may take many days before you feel sick, even though we know that the 2 days before you felt sick, you were still shedding the virus. You were contagious, so you were infectious and able to infect other people. Very different characteristics between the two viruses. Also, of course, COVID is a much more serious disease. It has more complications, so therefore you see more admissions from COVID. Of course, you see a higher fatality from COVID. So even though we have improved the mortality rates, the fatality from COVID is much higher than influenza. The other thing is there's no herd immunity. As of now, there's no vaccines out, so no one's really, quote, immune to it. So for all those factors, that's why we're in a pandemic. That's why COVID and flu is very different. So when you got a virus that's much more contagious, that lasts a lot longer, that is very easy to spread, that is much more serious and causes more deaths, you have an overwhelming amount of people that are sick at one time, which can, of course, overwhelm our healthcare system, which of course in lots of states in our country so far, we're seeing hospitals at full capacity. We're seeing hospitals that have to turn people away. They're having to transfer patients many, many miles away to try to get help because their hospital beds are full, their ventilators are full. They have no capacity. And so people need to really understand the difference. The other unique thing I forgot to mention about COVID is that it has many presentations. People tend to think of flu as having fever, chills, body aches, headaches, coughing, and it looks like a certain thing for most people. However, COVID's completely different because you can, number one, have no symptoms at all, meaning you feel fine. You can have very minimal symptoms and think it's allergies or a simple head cold. You could have sinusitis symptoms. You could have a chest cold. You could have pneumonia. Of course, you could be sick enough to go to the hospital. So since there's a big spectrum of potential symptoms and it mimics so many things, it's often not diagnosed, it's often not taken seriously. And so it's very easy for people to spread it. They can typically go to work and feel pretty decent for many days when they're still contagious. So for all those things, COVID is completely different than flu. The other thing I just wanted to harp on is that we can all do our part. So even if you're not a healthcare professional, we can all do our part. We all have personal responsibility to help in this pandemic. We all need to come together to try to do the right thing. And it's the same things we've been mentioning for months now. So trying to wear your mask as much as possible and limiting your unmasked exposures, meaning only having a few small set of people that you're around without a mask. And of course, that's your household members. But as that number increases, statistically, you are increasing the chance that you will be exposed and get COVID-19. Of course, washing your hands or sanitizing your hands, trying to avoid crowded places, avoid lots of people gathering, especially if you know you're going to a gathering where there's many people there not wearing their mask, wherever that may be. The other key things is once you know you're sick, and this could be any symptom, you don't have to be deathly ill. You don't have to think you have flu. You don't need a fever. If you're having new nasal congestion, runny nose, cough, sore throat, even just a day or two, that means you may have COVID. You need to isolate. Too many times throughout the week, I see patients who come and they're having symptoms for 4, 5, 6 days before they finally come, and I'm telling them they're positive for COVID. But those people were also in public the whole time. They were still at work. They're going to the store. They're getting their haircuts. They're not isolating. And those behaviors are reckless, and it's basically exposing other innocent people to the virus. So a huge piece of advice is if you think you're having symptoms, I don't care if it's 1 or 2 days of symptoms, if something's new and different, please isolate, and of course try to leave your home to get testing. And then stay at home until you get your result back, which may take a couple of days. So pretend that you have COVID until you get your test result back. The other thing is if you have a high risk exposure, meaning you know you were close to someone within 6 feet without masks for several minutes, and you find out that person later has COVID, you are considered a high-risk exposure. There's a good chance you may get COVID. CDC recommends that you should quarantine. The old-fashioned rules were quarantining for 14 days because we know it could take up to 14 days. They have changed that this week, actually. So some new changes coming where maybe the quarantine can be as short as potentially 7 to 10 days, depending on a test. So speak to your physician about that if you think you've been exposed to get good advice. Many things come into play about your own health as far as the length of time for the quarantine. But I'm finding that when people are sick, they're getting better at staying home, but their close contacts that were exposed are not quarantining. And they're waiting till they get sick to try to quarantine, but they were exposing people at work, for instance, or in public for a few days beforehand. The other thing is if you know you are sick with COVID, you have classic symptoms, or you've just been told you are positive for COVID, the rule is that you are supposed to isolate at home for 10 days, and that means isolate even from others in your home if you can, meaning try to have your own personal room, your own personal bathroom. Try to limit going in common spaces with other people in your household to see if you can prevent the spread of your virus to other household members if you can, obviously. But it does not mean leaving your home unless you're going for urgent medical attention. These are some of the basic principles we've been preaching for many, many months, but it seems that not everyone knows or understands why these things are important and how these things can help us mitigate and make changes to try to control the virus. Healthcare professionals are thinking that over the next 2 or 3 months, we're going to see those numbers continue to grow like they have been for the past 4 or 5 weeks, which is very scary. Right now, I'm not aware of a hospital in North Carolina at full capacity like many other states, but it could be coming. And what that means is if the hospital is at full capacity, you may need health care for another reason. You may have the flu and you need to be admitted. You may have been in an accident or have a gunshot wound, like a trauma. You may have had a heart attack. You may have heart failure, COPD, any other problem that's not related to COVID, but because of COVID, the hospital could be at capacity, might not be able to take care of you appropriately or not have the resources like a ventilator to take care of you. That's a scary thing and something that we know our behavior now can change. So the things we do now affect our admissions and numbers a few weeks from now. So the behaviors that we do now can change the numbers and cases in January and in February. And it's not just for those of us that are well. We really must consider our vulnerable, our patients who have a lot of medical problems, especially our elderly, of course, our folks in the nursing home. There's so many people who are very vulnerable to this disease, who are overwhelmingly suffering many complications. We have to think of those people because my actions affect them just like your actions affect them. And so we really must all play a part in doing our best to really try to control the virus best we can and be very wise with their decisions. And that's why I'm urging folks to really come together as a community to make wise decisions, have wise behaviors that's going to positively affect our community and help us stay healthier and stronger together. Thank you, Chairman Godwin.
Well, as I said, this is the winter solstice, and it's the celebration of Lumbee wisdom, and I want to thank you for your wisdom today, and I hope that our people will take heed to the wisdom that you provided today. You know, one of the things that concerns me, and we've been thinking about it and talking a lot about it at the tribal complex, is the mental drain that this has had on our people, all people, but on our people, because we can't socialize the way we normally do, and the spiritual drain. We haven't had our powwow. We haven't had Lumbee homecoming. We didn't have the elders come out here and pray for our well-being, which sustains us as a people, and they've been doing that for 50 years. But just being on this land, the Cultural Center land, I think is appropriate for us to have these conversations. But there's some things that the tribal government's going to be doing in December that hopefully will lift spirits of our people going into Christmas, which is the birth of Jesus Christ. And without our number one belief in God, this could be a lot worse on all of us. I'm so happy and proud that our core values as a Lumbee people are, number one, our belief in God, value of an education, protecting our culture and our identity, and our connection to this very land that we're standing on today, and where we live and play and work as from generation to generation as Lumbee people. Without our belief in God, this could be a much worse situation for our people. And the people that are praying, that are Lumbee, that are praying, people that are praying all across this nation, but even in our very community, praying for each other and believing that God's going to make us stronger on the other side of this. But we have to pay heed to our wisdom that God has provided us, that you've heard from Dr. Chamaine today. But we got to listen to our wisdom. We got to live by our own wisdom. And we're going to get through this. We still got a grind to go, but it's going to come. We're going to get through it, and we're going to be happier and more loving to our brothers and sisters on the other end. I just want to say thank God for the Lumbee people, thank God for America, and may you all have a Merry Christmas. Thank you.